Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Mental Health in the LGBTQIA plus community, presented by Dr. Suselina Acosta-Goldstein, psychiatrist with Washington Township Medical Foundation. Dr. Acosta-Goldstein is board certified in psychiatry with a Bachelor of Arts degree in biology from Columbia University and a medical degree in general medicine from University of Texas Southwestern Medical Center. Dr. Acosta-Goldstein's career is built upon her philosophy of care, and that extends to how she interacts with her patients. She approaches patients with curiosity and humility, and always on the path of learning. Please welcome Dr. Acosta-Goldstein.
Hello, my name is Dr. Suselina Acosta-Goldstein, and I'm a psychiatrist here at Washington Hospital. I primarily practice in the hospital, but I have a one-day-a-week clinic where I focus on peripartum psychiatry, peripartum mental health. I have a special interest in psychotherapy, PTSD, and the LGBTQIA plus population. Today, I will be speaking on the LGBTQIA plus community and our mental health, with a focus on microaggressions and next steps. First of all, welcome and happy Pride. In honor of Pride, I will be focusing on ongoing challenges affecting the mental health of the LGBTQ plus population. I will start with a brief history of Pride and why we celebrate. Then I will explain what microaggressions are and why they happen, how to actively reduce harm, and how to actively protect yourself. In this slide, I will present a very brief history on the origins of Pride. Please feel free to use this as a starting point to learn more. So acts of queer civil resistance have been occurring since the 1950s. Reminder Day pickets were some of the first organized demonstrations held annually on July 4th from 1965 to 1969 in Philadelphia. These demonstrations served to remind the American public that gay people lacked many basic rights. On June 28, 1969, in New York City's Greenwich Village, police raided the Stonewall Inn, which was followed by days of riots and protests. This bar had been raided before, but it was one of the first times that the LGBTQ community responded with protest and riots, which lasted for 5 days. 1 year later, the first Pride marches were organized across major American cities, including in San Francisco, to commemorate Stonewall, demonstrate gay visibility, and advocate for gay rights. The marches have been called by different names, but since the beginning, a primary message has been visibility, support, celebration, and pride in queer identity. Thus, Pride is born. Over the years, the movement has grown to be more inclusive of people of color and different sexual and gender identities, and is celebrated internationally. This slide is just listing names of queer activists and icons that were shown on the previous slide. This is by no means an exhaustive list, so please go out and learn more about the many others that played roles in the evolution of Pride. In this slide, I'm going to be going over some terms and definitions. The acronym LGBT has been in use since the 1980s, standing for lesbian, gay, bisexual, and transgender. The acronym has since been expanded for inclusivity. In this lecture, I will be using the word queer, which is an identity that is different from heterosexual, i.e. straight, and/or cisgender. What is cisgender? Cisgender is identifying as the same gender that one was assigned to at birth. What is heterosexual? Heterosexual is sexual or romantic attraction generally exclusive to persons of the opposite gender. There are numerous terms to describe oneself, and keep in mind that some people choose not to label themselves at all. I have listed several terms here and have added some flags to represent different identities. The San Francisco Gay Men's Chorus writes on their website about identity labels. The website is listed here for reference. Our understanding of ourselves and others is always changing and evolving. To me, that means that the words we use to describe ourselves are constantly shifting, and we should be flexible in our expectations of each other when it comes to understanding these different identities. So queer identities generally fall under two categories: sexual orientation and gender identity. Sexual orientation describes who you are sexually or romantically attracted to. Gender identity is where on the gender spectrum that one personally and or publicly identifies with. I'm not going to be going over each of these terms in the interest of time, but want to point out a few that are not typically talked about. Up here in this black and white flag is the ally flag. An ally is a person who is safe or supportive of the LGBTQ+ community. Down here is the Pride Disability flag. It is presented in muted colors to improve visibility for color blindness and to reduce the likelihood of triggering migraines or seizures. This up here is the intersex flag for those who are born genetically or biologically neither exclusively male or female. I'm going to be going over one more definition: heteronormativity. This definition is going to help us understand microaggressions. Heteronormativity is the assumption or attitude that being heterosexual and cisgender is the normal and the ideal, that other identities are not natural, that one should prefer to be normal and ideal. Heteronormative messages are societal, historical, and contemporary, everywhere, every day, and in everyone. Within ourselves, these ideas happen both consciously and unconsciously. It is each individual's responsibility to consciously speak and act more inclusively. But how? The LGBTQ+ population has suffered violence, discrimination, harassment, and social exclusion from the vast majority of modern history. While we might not be seeing or experiencing the same kind or level of hate from decades past, these forms of aggression are definitely not over. However, today I will be focusing on a more common, everyday form of aggression, one where we can practice agency and positively affect those around us. Microaggressions. This definition is not mine and comes from multiple educators from the past decades. Please look at my list of references at the end and also look online for more. Microaggressions are brief and commonplace daily verbal, behavior, or environmental indignities, whether intentional or unintentional, that communicate hostile, derogatory, or negative slights. You might be thinking, wait, that's not me, I don't do that. But please keep an open mind and heart and allow me to explain further. The language you use every day, from casual conversation to deep discussions, is reflective of society's values, knowledge, and experiences. Every individual, whether LGBTQ+ or not, cannot escape society's daily messages about what is valuable. The LGBTQ+ community has traditionally been undervalued, misrepresented, and negatively experienced. Therefore, the language we will use will be reflective of this, no matter our own values or our intentions, and can be expressed as microaggressions. On the next two slides, I'm going to be going over some examples. For example, casually telling a gay man, "You don't seem gay," or telling someone, "You don't look trans," as if these are compliments. This erases part of their identity that is important and valuable to them, something they may take pride in. This reinforces the stereotype that gay men should be flamboyant, loud, or feminine to be seen. This conveys the idea that trans persons must look entirely masculine or feminine to be accepted. Here are a list of other examples. I'm not going to go through all of them, but I will focus on the first two. I was listening to a podcast the other day where the storyteller told the young people in the audience to be thankful for their mom and dad. But people may have two moms, or one dad, or multiple parents, or step-parents, or grandparents. Instead, telling the youth to give thanks to their parents, or their family, or their loved ones is more inclusive and does not convey the message that only people with a mom or dad are part of a normal, ideal family. Accidentally using the wrong pronouns. Accidentally using the wrong pronouns even after knowing the person's preferred pronouns can happen very commonly. Understand that unintentionally calling someone the wrong pronoun can be completely normal. In modern society, we see dozens or even hundreds of faces every day. It would be impossible to get everyone's gender identity right in our every thought. But also understand that the person that you just misgendered likely hears this every day and can be quietly suffering. Intention and effort is important in combating this harm. This lecture is focusing on reducing harm towards the queer community, but I wanted to include this slide as a reminder that microaggressions are also experienced across many groups of people. The idea of microaggressions was first developed around the idea of racial harm. I have several cartoons pictured here from the internet from some artists that I also follow, so please take a look at them while I continue to talk. To better understand microaggressions further, I will share an idea that I read in my own learning. Think of microaggressions as little paper cuts. A few cuts here and there are not going to do much harm. But if you have hundreds of cuts or the same paper cut every single day, this can cause some serious harm. If you are the receiver of multiple assaults every day, sometimes multiple times a day, this can cause persistent stress that distorts one's idea of themselves and the world around them. There is also growing research in regards to racial microaggressions that this low-grade chronic stress can cause measurable differences in not only a person's mental health, but also their physical health, like increasing the likelihood of stroke and other cardiac problems. Now, what to do when you are expressing biases. Acknowledging your mistakes and apologizing can go a long way in reducing harm. This tells the person that you are being thoughtful and conscious about the words that are coming out of your mouth. Ask questions with trusted persons. Pause when you make an assumption, any assumption. Be curious, but be respectful and do not demand. Queer persons like myself choose to be educators, but it is not the responsibility of every queer person out there to educate you. There are plenty of educators online and on social media and in the literature, so please go out and search for them. And reflect, reflect, reflect. Ask yourself hard questions and learn to be okay with being uncomfortable. If you cannot do this alone, seek the help of a therapist. What to do when you're experiencing biases? Observe, don't absorb it. What does that mean? That means separating yourself from what you're experiencing, what you're seeing. Tell yourself, describe to yourself what is going on. For example, this person just called my wife my sister or identified my wife as my sister. And that has happened to me 2 times this week, period. This does not need to say anything about me or my wife or about the person in front of me. It could be a reflection of what this person commonly sees or what society is saying. Appreciate the difference between acceptance and approval. Acceptance and approval is very tied together, but it doesn't need to be. Understanding these concepts is not easy or straightforward, and implementing what you learn takes practice and patience. If these 2 strategies are difficult, please seek the help of a therapist who could walk you through it more. And remember, you are not obligated to educate others or to prove yourself. Choose when, where, and who you educate, only if it's helpful to you. Educating others takes time and effort and emotional energy. No one has unlimited access to these energies. Again, if you find yourself struggling, please seek the help of someone in mental health. You do not need to have clinical depression or another clinical diagnosis to benefit from talk therapy. I am going to end with these thoughts. We all need to be more aware of the messages we are sending with our words and make changes to our language. When a person consciously changes the words they use, they also can change their own perspective of others. Society needs to change their perspective of the LGBTQ+ community to one that sees us as valuable, capable, and equals. This alone can do so much for the mental health of the LGBTQ+ community. I'm going to end with a few links that I used for this lecture. This is by no means everything that is out there, so please take the time to go out and learn more. Thank you so much for joining me and learning about these difficult topics and trying to make a difference in other people's lives.
Thank you, Doctor. We do have a couple of questions for you today. The first is, what do you do if you encounter someone who constantly throws microaggressions at you?
That's a good question. One of the things I didn't get to speak about in this presentation is boundary setting, because we could do a whole presentation on boundary setting. But I could try to summarize it in a few sentences. Boundary setting is emotional, physical, or verbal actions that you take to put things in your control. Boundaries, it's a very vague term, but boundary setting needs to be specific to the situation. It needs to be in something that is in your control, something that is reasonable, something that could happen. And well, those three topics, those three things. For example, if you notice a pattern of someone constantly making microaggressions towards you, you could say to yourself, I will engage with this person, I will try to educate this person only when I am rested, only when I am not emotional, and only one time, for example. If that doesn't work, then you adjust your boundary or you walk away.
That's very good. Thank you. And the last question we have is, what is the best way to support the LGBTQIA plus community during Pride Month?
I'm going to be biased and say the best way to support is take what you learn here and talk about it. Talk about it with people who didn't come to this lecture. Talk about it with people who are open to these ideas but maybe haven't spent the time to go out of their way to learn. The more people are talking about the way they think and treat and speak about other people, the more our actions will change, individually and as a society.
Okay, thank you. This does conclude our program. Thank you, Dr. Acosta-Goldstein, for this insightful presentation, and thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.